For renal stone detection is the topic of our discussion today. Renal or kidney ultrasound is non-invasive imaging technique that uses sound waves to create pictures of kidneys and bladder. In renal ultrasound scan, a computer processes the returning sound waves to create real-time images of the kidneys and surrounding areas. In some cases, a Doppler ultrasound may be included to assess the blood flow within the kidneys. How are kidneys visualized on ultrasound? First, orientate the probe along the long axis of the kidney. With the left kidney in view, we adjust gain and then adjust focus to optimize image quality. Now freeze the image and illustrate the relevant anatomy. Renal pelvis on ultrasound appear as a central branching hypoechoic or darker structure within the kidney surrounded by echogenic brighter renal sinus fat. The renal cortex is the outer layer of the kidney. After detecting, measure the cortical thickness, which is typically between 7 to 10 mm. Renal parenchyma appear as relatively homogeneous structure with variable echogenicity or brightness compared to other abdominal organs. Its thickness is approximately 13 to 25 mm. The length of the kidney is about 10 to 12 centimeter long and the width is about 4 to 6 centimeter. Rotate the probe anti-clockwise through 90 degree. Examine the right kidney in the same way. Now, why renal ultrasound is used for kidney stones detection? In fact, the renal ultrasounds can effectively detect the kidney stones, which appear as bright echogenic foci or white spots on the images. Stones often create a shadow behind them called acoustic shadowing, further aiding in their identification. Acoustic shadowing appear as dark area or shadow behind the stone caused by stone's ability to block or attenuate the ultrasound waves. This shadowing is a key characteristic that helps to differentiate the kidney stones from other structures in the kidney. Color Doppler can show a twinkling artifact around the stone, another helpful sign. Ultrasound can also identify if the stone is causing blockage or obstruction in the urinary tract, leading to hydronephrosis, that is swelling of the kidney, and dilated calyxes. What are the advantages of renal ultrasound over other methods? First of all, it is non-invasive and painless technique. Unlike CT scan, ultrasound do not use radiation and are generally more comfortable for the patient. Secondly, it is cost effective. Ultrasound are typically less expensive than CT scans. Thirdly, it is a first line imaging. Many guidelines recommend the ultrasound as the initial imaging method for suspected kidney stones, especially in cases of suspected obstruction. Renal ultrasound is a non-invasive imaging method which uses high frequency sound waves that bounces off the organs and internal structure, echoing back to form image that can be captured and studied, such as to check the presence of kidney stones. While CT scan may show a little more detail, a renal ultrasound is also commonly used and preferred. The main advantage of renal ultrasound is that it is easier to schedule, less expensive for the patient, and still a very effective way to diagnose kidney stones. Another reason for choosing ultrasound over CT scan is that CT scan exposes the patient to small amount of radiations. While this exposure of the CT scan is low and considered safe, many physicians advise against the unnecessary repeat exposure when possible. This means that if a patient has recurring kidney stones such as cystine stone, repeat imaging will typically be done using non-X-ray methods such as renal ultrasound. There are certain limitations of the renal ultrasound as well. First of all, the smaller stones cannot be optimally detected, especially those located near corticomedullary junction or in the ureters. Secondly, the stone size estimation cannot be done effectively and it is less accurate than with the CT scan. Ureteral stones cannot be effectively visualized, particularly if they are small or impacted. Here we have uretropelvic junction stone demonstrating shadowing plus hydronephrosis. So that was all about ultrasound scan for detecting renal stones. Subscribe on Obs and Gynae and write in the comment section of this video, and follow the Facebook page of On Obs and Gynae.